We wanted to improve access. So we know there's some real challenges around people being able to access booking centres, people on the end of a telephone. So very much that was one of the driving factors behind what we were looking to implement. We wanted to be a bit more inclusive. So again, for those where it's an appropriate solution, that we've got that sort of tech-enabled way for people to interact. And again, the secondary benefit of improving access for those who it isn't. So if we are able to divert traffic away from their telephone centres, then actually that would improve people's experience who are still wanting to go through more traditional routes. We wanted to give some choice as well. So again, it's not a single solution. We weren't kind of switching off anything else. It's another way that people can access that. So we're improving the number of routes that people can access our services in MPFT. It's absolutely improving the access. So the fact that it's available 24 hours a day means people who might otherwise have difficulty making those telephone calls during their working day can now interact and alter their appointments outside of traditional working hours, which you know is absolutely working for them. Around 37% of our interactions are in fact outside of usual business hours. It's giving us a digitally enabled front door. So again, for those people that need that as a different tool, a way of interacting with services, it absolutely has helped to provide that. And it's also providing a greater degree of control as well. So for those people who are able to access it and can do so, again, it enables them to be able to interact with their healthcare services directly in front of them at a point in time that works for them. It's certainly going to help pave the way to get some of those productivity gains that we're hearing so much about. So the fact that we can reduce how much strain there are on our booking centres, we can redirect staff to do higher value tasks. So as we look to roll this out across more services in our footprint, we should start to see more and more of those efficiency gains. So that access, driving forward patients' abilities to interact with their services, but in a way that works for them, is freeing up our staff to do different jobs rather than simply having to manually manage telephone lines. We've had some great feedback so far. So 92% of our patients were satisfied with their experience. As I've said, that 37% of people that are accessing it outside of their working hours found that to be a great benefit to them. We've had some quotes along the lines that people actually prefer it. It's the way in which they would prefer to interact with their services. So we have seen a degree of preference in some parts of our population. People have found that it's useful. Again, it's that improving access. It's exactly what people want and that they need. So the ability to simply check where your appointment is, when it is, and who it's with, if you weren't able to write it down or something's changed or you weren't sure. So again, absolutely giving that control back to people. And we have found that people are reporting that it's easy to use. What we don't want is tech that's inhibitive, that it's a challenge to interact with. So we have found feedback that very much it's an easy and simplistic thing to interact with.